The stories of harm to children while in care only highlight the need for strengthening investments in community-based models. And I just want to emphasize again, we actually have good news on this front. First, let me go back, though, to say that President John F. Kennedy, the last bill he ever signed before his own death in 1963 was the Community Mental Health Act. It had two visions, one to eliminate what were called asylums at the time, and the other was to provide comprehensive community care, which we have not done until this point. And we now have, through a model that 20 states are receiving full funding for now through Medicaid, a healthcare model called Certified Community Behavioral Health Clinics. We have services being provided, over 500 clinics across the country, more that needs to be done, and certainly more to be understood, because this is a new model, comprehensive model, based on federally qualified health centers, funding behavioral health care as health care. But this is a really important model for us to be embracing, I believe. CCBHCs provide comprehensive services. They're equipped to care for children and youth with complex behavioral health needs, everything we're talking about today. According to the 2020 Department of Health and Human Services report on the first 8 states being funded for these clinics, about 1/4 of the patients are children and adolescents. And just last week, the National Council for Mental Wellbeing's latest report on the impact of CCBHCs nationwide, and by the way, they've said that one of the most important ways that services have been expanded through these clinics is for young people. Services for young people. The same report showed that 82% of the clinics have established teams that are specifically child and youth focused. 82%, which is good news. And 83% of the clinics provide services in one or more school settings. So we're talking about clinics that require 24-hour psychiatric crisis services, comprehensive services. Anybody who walks in the door can get care based on a healthcare model. And I hope, Mr. Chairman, we're going to be embracing and looking more at what is actually happening now to meet some of these issues. Obviously, we need inpatient that's quality care also. But we are, in fact, moving forward on comprehensive behavioral care, and I hope we're going to be embracing this more and more.